Okay, it's Tuesday, March 4th, 2025. I'm about to head out to Colorado, hopefully, because there's going to be a blizzard tomorrow, to see my leak doctor at UC Anschutz or whatever. I've been a leak patient for quite a few years, and I thought it might be helpful for others to kind of see what I tend to pack. I used to kind of overpack just because I couldn't predict what symptoms I was going to have or treatment or imaging. But I've kind of narrowed things down. The thing I want to emphasize is that it's going to what you're going to pack is going to be based on like what symptom tends to present to you more prominently. Sorry, I'm a little out of it because there's a blizzard coming. But yeah, right now for me, nausea is a big one. I'm getting a lot of like imbalance issues. I'm having some cognitive issues. And then I know that like once I'm right in the sun, I'm gonna have issues with light sensitivity. So I'm just gonna show you what I plan to bring. One of the good things that we've realized is that you can do like an online retailer, like we use Walmart, where it's kind of hard to think, what's it going to be like once you actually get to like, because everybody's traveling, and that's my cat. Everybody's traveling to get treatment. You're not really thinking about like what am I going to eat, but we've been down this road quite a few times. So what me and my husband tend to do is we will put a Walmart order in, have it delivered, and then we will have food and paper plates and then also toiletries. And that's helped quite a bit because then we can kind of save on that TSA, like certain whatever ounces. Because we don't want to check a bag just because, like, again, my husband has to carry everything and it's just kind of a big ordeal. And honestly, if you've been through this long enough, like you know what you need, and I'm pretty sure what I need. Again, it's going to be based on your symptoms. So here's kind of what I have picked up for our trip. We are going to be staying there for 7 days, but as many people know, I'm having treatment, so I have 3 days in bed rest after that. So what you wear is going to be dependent on your symptoms and also the weather, obviously. I know when I first started leaking, I ran very hot all the time, so I would keep that in mind. Currently, I run really cold, so I tend to bring extra sweatshirts and just bring long socks just to make sure that I stay warm to my preference. If you do feel like you need it to be extra cool, they do have these like really thin, comfortable like pajama sets. You can get them on large online retailers that are really comfortable. Keep in mind you're going to have lumbar punctures. You're going to be laying in bed, depending on your age. Like that can be quite a bit of like discomfort. So my preference is to stay comfortable. I always just bring sweats for everything, every appointment and stuff. So I have 3 sets of sweats. We intend to do laundry the last day that we're there. I also have a packable coat because there is a blizzard coming, but again, it's just going to be in and out of cars and Ubers and stuff. Um, so as many people know, sometimes there is medicine involved with imaging that can give you constipation. I find that this works really well. We just get ordered just like bottled juice. Sorry if I start slurring my words. We just order bottled juice from Walmart. I just dump one of these in, and I would start it the day before you get I think it's called fentanyl, the medicine that really it stops you up. And you can say, oh, I'll be fine, I don't have a problem with this. It's better to be prepared because things like straining while you're using the bathroom can really screw it up. It not only screws up your treatment, it could also cause pain. So get on it, early. I have my humorous little, if you know Parks and Rec, this is kind of my like grab and go pill. So for me, I don't do NSAIDs. So I just have Tylenol in here. I have Zofran for nausea, and then I have my emergency anxiety medicine in here. And that's something you can ask your doctor about. For entertainment, I used to bring a stand for my tablet, but I'm kind of like at the point where I don't care. This is my entertainment for, the trip. You can read books on here, you can watch movies on here. The one big recommendation is do not watch anything too funny or too sad, because if you think about like bracing your abdomen to laugh or to cry, you do not want to do that. Uh, so these ice packs, you can get them at like pharmacies, but obviously, if you've been to leak centers before, can send you home with a lot of these. I think Colorado just like sends you home with like little bags of ice, and then you get ice from like the ice machine at the hotel or whatever. Um, these are gigantic glasses that go over like your actual glasses. I'm a glasses wearer. And they are really helpful. They like block out the light from the top, the sides, the bottom. They're really cheap, and they are so helpful. They've saved me a number of times. I just have like a hat and gloves here. And then you can tell what my main symptom is right now, right? These are anti-anemesis. I don't know how to pronounce it. It's like a vomit bag. You can buy these online, but they're really helpful, just mainly for security. In a pinch, my lovely mother-in-law also struggled with nausea, and she would do 2 grocery bags bagged on top of each other just for insurance. And this is, I have other ones of these, but this is an anti-nausea stick. This is just a smell that Mayo hands these out, but you can also buy these online, and they're really good for just like helping ease your stomach when you're having nausea. Obviously, Zofran is an option, which I use regularly, but this is another option too. Just like hit it from every different angle. Okay, I realized I forgot one more thing. So this is a travel grabber stick. Um, I I have multiple kinds of grabber sticks. This one just like folds up so it's easier to fit into a carry-on bag. You can see like, okay, here's like a standard suitcase size, and this could fit into a standard suitcase where, let's see, this is one of my main daily drivers, and this would not fit into a carry-on suitcase. We have tried traveling without a grabber stick, and my husband has been like, "Oh, we really need to get you a grabber stick," just because I depend on them so much for like getting dressed and just like doing day-to-day things. Like, you do not know how many times a day a person drops something on the floor and needs to pick it up or get something from a lower cupboard. So these are really, even if you're spending the majority of the time in a hotel in bed, not changing clothes, it is so helpful. And just for like self-confidence, I think it's worth it.